All right, guys, let's get busy talking about autism spectrum disorder, which is going to be a disease that is usually identified early in childhood. Usually, we identify this disease less than 3 years old when patients start to develop social skills and their ability to communicate their needs based on what's in their environment. So, we characterize autism by difficulty with communication and social skills. So, these patients will have trouble identifying social cues. Like, for instance, if I do a mild smile, like this, or raise my eyebrow a little bit, or like scrunch my eyes. Those are cues that you can pick up on that tell me how I'm feeling and how I'm relating to you. Patients with autism have a lot of trouble picking up these cues and also mirroring these cues. So when they are upset, they have difficulty communicating those feelings in subtle ways, and they may go like 0 to 100 really quickly. So I'm just going to highlight for you here difficulty recognizing and reflecting social cues and body language, and this leads to difficulty with relationships. So if you were upsetting me by doing something, instead of like subtly being like, yo, I'm kind of uncomfortable about that, or like, hey, like maybe let's switch topics, a patient with autism might just like start screaming and be super uncomfortable because they have no other way to channel those emotions or process those social skills. Additionally, some other interesting things. Patients with autism tend to have narrow interests. So they may be like really obsessed with a certain cartoon or like space or horses. An example here in this kid, we can see he's wearing a Sonic the Hedgehog shirt. He might be obsessed with Sonic the Hedgehog, and that's all he wants to talk about over the course of a 30-minute conversation. Additionally, some patients can have specific talents, so they may be exceptionally good at math or music. They may have an uncanny ability to name any date on a calendar and the associated day of the week. This is a common finding in our patients with autism. Also, some patients can have intellectual disability, and the degree of this disability can range, and it really doesn't have a specific set limit as to how impaired a patient with autism can be. Also, characteristically, we have sensory intolerance. And what does this mean? Oftentimes, patients with autism have difficulty tolerating really loud noises or noises they don't like. So you'll find them covering their ears or finding ways to find a quiet environment that is comfortable for them. Additionally, they tend to be really specific about the clothing they wear. Like they might not like wearing a choker or a really scratchy shirt because they have increased sensitivity with tactile sensations that they don't enjoy. Additionally, these patients tend to have really low tolerance for change. So when something out of their routine that is normal changes, or there's like a new shirt or a new sound or a new routine, it can be really upsetting for a patient with autism and it can lead to outbursts. And that might be an identifying symptom for you on test day. Now, one thing I want to mention is that this usually happens when we're less than 3 years old, is when we identify autism. However, it's not a requirement. That's just generally when it happens because of when we start to develop our social skills and ability to communicate our needs. Now, let's talk about some associated conditions. There is a strong connection of family history with autism. Additionally, it is associated with ADHD and conditions like Fragile X syndrome, which are often identified in childhood. Additionally, we can see increased brain and head size in our patients with autism. If you look here, this child has a rather large head. It is not overly large, but if you were to measure it, you would see that it is larger from a child at his age percentile. Also, we tend to see an increased prevalence in our male patients with autism compared to our female patients, and this is important when it comes to making differentials. One more thing I want to mention is that there is no evidence that suggests a connection between autism and vaccines. That is something that tends to come up often in media, and I just wanted to clarify it here in our course. In terms of prognosis, the degree of impairment is going to determine the prognosis for our patients with autism. And really, treatment plans are going to revolve around identifying the gaps that these patients have and meeting those gaps with specialized services. Now, in terms of differential making, it's important that we touch on a few things. So first, let's talk about Rett syndrome. So Rett syndrome is going to occur exclusively in females, whereas autism tends to happen more in males, but can happen in females as well. And the reason why I talk about Rett syndrome is because it's characterized by like hand wringing and like mouth movements and like blinking and like weird tactile physical movements that are repetitive, and also some degree of intellectual disability. This is also seen in autism, so it's important to differentiate. A Rett syndrome question may mention something about an MECP2 mutation, and that is a mutation that is specific for Rett syndrome, and also Rett is only found in females. So that's an important thing for your differential. Additionally, we can talk about language disorders or other specific learning disabilities. A person who has difficulty communicating with language may have difficulty meeting friends and making connections simply because language is really hard for them. That is not why autistic patients struggle making connections. They struggle because of like social cues and ability to adapt and change and endure like changes in sensation and changes in routine. Those are the reasons why autism patients have difficulty with relationships. It's not necessarily dealing with language, and it's important to be able to make that differential. Additionally, a patient who is having trouble like doing well in school or relating with friends may have difficulty with hearing or vision, and it may be that they simply cannot see their mom or dad, or they can't see their peers, or they can't hear instructions or conversations. So a great way to get a question right on step one is to really listen in if they're hinting towards you that there's some deficit in vision or in hearing, and that can be a great way to differentiate between autism spectrum disorder and some other condition relating to the five senses.